Welcome to eZeLiving.com. I'm Dr. Naveen Al-Saleh, and on today's show we have Dr. Vanda, who's a chiropractor and an expert in pediatrics. And our topic for today is why infants cry all the time for no reason. Hi Dr. Vanda, how are you doing?
I'm doing really well. Thank you for having me, Naveen.
So why do infants cry?
Well, there's several reasons why infants cry. 4 reasons, mostly. 1 is that they need to be changed. 2 is that they're hungry. 3, they are either too hot or too cold. Or 4, they just might be uncomfortable.
So let's say the parents have done all of the above and they've taken their infant, their crying infant, to the pediatrician, and the pediatrician says, well, your infant is normal, there's no problems, and the infant continues to cry. Now, as a chiropractor, why would these parents bring their infant to you?
Well, what we do as chiropractors is we actually check out the integrity of the spine just to make sure that everything is functioning normally. So what happens with infants that cry a lot is that it's possible that they have some type of birth trauma that could cause them to cry incessantly.
So during birth, what kind of trauma could happen to the nervous system that could cause certain symptoms for the infant to cry?
Right. The most common is a neck injury, a shoulder injury, and hip injuries.
So with neck injuries, what usually happens? Is it when the head is, when there's crowning of the head and there's trauma to the neck, and what symptoms would the infant be experiencing?
Right. Because the nervous system is the master control system, everything is controlled by the neck. So there's actually a whole lot of symptoms that can actually show up because of neck trauma. But the most common would be that they either can't put their head backwards to
extend.
Yeah, they can't extend their head, or they can't like latch on properly to the nipple to feed because they're in pain. They try to go backwards and it hurts, so
and
they
then
start to cry.
usually with these infants, if they can't extend, they're probably not sleeping properly.
Exactly. So they can cause all kinds of sleeping problems. They're not getting enough rest, and of course, when the baby's not sleeping, the parents aren't sleeping.
Definitely.
Yes.
And with a shoulder injury, what could happen if, like, let's say the doctor kind of pulled on the shoulder during birth? What symptoms could the infant experience?
It's very common, and one of the primary reflexes of children is what's called the grasp reflex. So you put your finger in their hand and they squeeze your finger. And if they're not unable to do that, the nerves from the neck are not going properly down into the arm, so that we know that there's some type of problem. And that can cause lots of issues later on in life as well, if it's not corrected.
And sometimes infants are not in the correct position while they're being delivered, and the doctor pulls on their foot or their hip. What kind of problems can happen then?
The most common would be constipation, or actually diarrhea, but constipation is most common, especially in infants.
And why? How would that be linked to pulling on the leg?
Right, because all the nerves that go to the large intestine all start in the lower back and in the hip. So if something is misaligned and the pelvis is moved, it can cause pressure on those nerves, and then just things don't work properly. So then constipation happens.
And there could be that symptom as well as indigestion as well.
Absolutely.
And bloating. And is that linked to colic as well?
Yeah, colic is what people define as just unknown crying. And I've actually had patients come into the office, little babies, who, one I had a 2-week-old, and she started crying at the age of 4 hours old. Mm-hmm. And so her parents were so excited for her to show up, and then they kind of wanted to put her back where she came from because she just cried nonstop for 2 weeks. And what we did was just some very simple adjustments to the lower spine, and worked with the bloating and the colon and the indigestion. And within 3 days, all the crying had stopped.
Now, one question I'd like to ask, is there any kind of correlation between what the mother is eating and why the infant's crying as well?
Yes, especially, well, if they're breastfeeding, there is. You want to stay away from more gaseous foods, like dark leafy green vegetables, or broccoli, for example, can cause a lot of bloating and indigestion in the baby, because it comes from the mother.
Parents, for them to send their little infant who's so soft and gentle to a chiropractor is a bit scary. Are there any side effects, and how can you make parents feel comfortable to bring their infants to you?
Right. When a baby comes in, I mean, obviously people have heard crazy stories about chiropractors, but usually those stories are from people who have never been to a chiropractor. It's extremely gentle, and with babies we take the utmost care. The pressure that we use might actually only be the weight of like my fingertip just pressing down, or a dime on the back of your hand. It's extremely gentle, extremely light, and I always tell exactly what I'm doing, usually show it on the mother first before I even touch their child, because I mean it's their most precious commodity, so we don't want to do anything that will harm them at all.
And usually with the infants, because they don't have that muscle memory of trauma as an adult, they would not take as many visits so usually how many visits on average would an infant need?
It depends on the severity of the problem. For example, with the colic, I saw them 3 times, and she's doing wonderful. She's 6 months old now, and she has absolutely regular sleeping and eating patterns, and the parents are very happy, and they're glad they kept her. Yeah.
So if your infant continuously cries, not pooping properly, not eating, and your pediatrician basically says there's really nothing wrong with your infant, it's a good time to really check with your local chiropractor. I'm Dr. Niveen El-Saleh. Thank you for tuning in to eZeLiving.com. Please leave all your comments right below, and don't forget to subscribe for great health shows.